When I started down this road with pediatrics, I was just like most chiropractors. I learned a little bit of peds in school and really wanted to attract the whole family into the practice. And I've had many interesting cases over the years that, especially in the early years, that began to make me really sit back and go, there's something different. I don't know everything I need to know about this population. The first thing that really intrigued me about children was how quickly that they recovered. And many of the children that I was seeing at that time were considered healthy children. So I was very interested, what is it? What is it about pediatrics that just makes them soar just with the touch of an adjustment? And then over the years, there were more difficult cases. There were cases where children couldn't handle sounds. They couldn't handle touch. They didn't know how to process. And then the very tool that I had as a chiropractor, I felt limited because I couldn't adjust them. Their nervous system couldn't handle it for a variety of reasons. And then I really dove in. Now, I became a pediatric diplomate through the ICA, and there are two different programs in chiropractic, and unfortunately, I don't think we need to have two, but we do. So if you're ever interested in obtaining a certification, I would encourage you to go through the ICA. It is recognized by both the ICA and the ACA as the Pediatric Diplomate Program. So that's always one possibility. In addition, I was asked to teach in that program, and my charge was neurology, and of course I wanted to do a great job. My next destination was when I became a neurodevelopmental therapist through the Institute of Neurophysiological Psychiatry, and that's when things really changed, and I understood the origin of the reflex system and its huge part in wiring up the nervous system. So I have gone down this road, and it's taken numerous years to acquire the skill, but I continue to go out and lecture in our chiropractic community, and I'm still amazed that there are so many chiropractors that really do not have a solid foundation in pediatric development. Now, not everybody wants to go through numerous programs, and that's completely understandable. But I'm asking you then, reach out to somebody like me who's actually making it a way for you to acquire this information, because I certainly can't be everywhere, and anybody else who works in the same kind of direction that I do, we can't be everywhere. We need people to truly understand the development of the nervous system and how it plays a part, especially during those first 8 years of life. And then, of course, there's the concepts of conscious parenting before you ever get pregnant, and then during your pregnancy. So really, where I am now is I want to get to these young couples before they ever plan on conceiving a baby, because I used to believe that if I got to you early enough, then we could just change everything. But the stats are growing by leaps and bounds. 1 in 6 children have some type of altered developmental issue. 1 in 66 is going to be diagnosed autistic. This is just completely out of control. So we play an active part because we look at the entire body. We are not part and parcel. But you must have a foundation in pediatrics. So if I were to ask you a couple of questions, when do you expect a child to demonstrate a reciprocal arm swing? So I'm going to ask you to think about that for a minute. How many months should a child crawl? When is a child expected to roll over? What are the first sounds that children are actually making? If you don't know the answers to these questions readily, then you're not getting that foundation of pediatric development. And that's what the point of this video is all about. Many of you have seen me present at different conferences. You may be receiving this because you just saw me at a conference. So this is my way of getting some information out to you personally so that you understand what I have to offer in trying to coach you in order for you to have exceptional skills in working with the pediatric population. So I've actually created these neurological bags, and what these are for, they're really for the doctor. These are tools for you to understand that children are supposed to do certain things at certain times. Now there's developmental toys inside of these bags, and what you're geared to do is to take something out and watch how the child engages with this particular toy while you're interviewing the mother. This will allow you to observe what the neurological and chronological age is. And the interesting part about it is if we're working with a child that's 4 and they're not able to engage, we go all the way down to 2 years of age, and then after that we're going to rely on the developmental milestones to look to see what that child is actually able to do. This is going to begin your examination process. So from there you have an idea how this child interacts with their environment, what their neurological age is, which then guides you into how do I examine this child. But by the time you get done with the history from the mom and observation, you really should have a good idea of what that child's neurological age is. And then from there, in coaching with me, what I offer is I want you to send the forms to me from that new patient and allow me to work side by side with you in interpreting your findings and setting up your management plan. There's several manuals that go with this program in addition to the neurological toys, as well as the one-on-one coaching. So please consider this in your approach in getting ready to learn more about the pediatric population. I'm here to serve, and I look forward to working with you.